with respect to the Department of Public Health statistics. If you would tell us about the kind of rate of infection amongst those fully vaccinated with 2 shots, and also comparing that to those who've had their booster and 2 shots.
Yeah, thank you, Chris. Well, recently the Department of Health updated the data dashboard to distinguish between vaccine breakthrough rates for those who are vaccinated with 2 doses and those who have received the 3rd dose or the booster shot. So what we see in the Hispanic community, according to the data, and also in the rest of the demographic groups, is that people who got the booster are less likely to get reinfected compared to those who doesn't have the booster. So to put this in context, or to give you an example, in the Hispanic community, there have been reported 4,470 cases with a booster compared to 29,264 cases among Hispanics without a booster. So there you can see easily the importance of getting the booster shot, because the difference is quite big.
And perhaps with that in mind, with the booster shot in mind, do you mind reminding us who is eligible for a booster shot right now?
Sure, and it's always very good to make this reminder to our community. People who are 12 or older that received the 2nd dose of Pfizer at least 5 months ago. Also, people who are 18 years old or older that received the 2nd dose of Moderna at least 5 months ago. If you got the Johnson & Johnson vaccine, you should get a dose of Pfizer or Moderna 2 months or more after you first got vaccinated. So all this information, it's in COVID-19colorado.gov. You can find all the information that I gave today or any other updates that are coming up for COVID-19 here in the state of Colorado.
With that in mind, Dr. Ricardo, 2 questions for you. The first one of which is, I suppose, one that we're getting a lot of right now is, will there be a need for a 4th shot of COVID-19 in addition to the 2 shots and the booster?
Thank you, Chris. And I will say that this is a tricky question because we're talking about a 4th dose when we still have a large proportion of the population who still doesn't get a 3rd dose. Indeed, I can share that some of the people that I see at the Mexican consulate in the Ventanilla de Salud have 2 shots. And when I offer a 3rd shot, they say, no, I'm okay. I'm completely vaccinated with 2 shots. And we're trying to find ways to convince people to get their 3rd shot. Now, in June of last year, there was a study made in 3 university hospitals in France where they started to identify that a group of people who had a kidney transplant who were immunocompromised because of the medication that they give them so they do not reject their kidney, didn't have an adequate increase in their antibodies with the 3rd dose, so they used a 4th dose and they had a significant increase in the antibodies in these people. So this has made other nations focus their attention on the possibility of using a 4th dose in people who are fully vaccinated. Indeed, Israel and Germany are already using a 4th dose for hospital workers, for elders or 60 years and older. They're not that elder, but people in their 60s, and for people who live in nursing homes. So now we're thinking about that. The United States and the United Kingdom are still looking at the information and trying to make a decision based on scientific basis. Indeed, I don't think that we will have enough resources to vaccinate the whole planet every 6 months. So we have to find the idea of who are going to be those people who can benefit from a 4th dose. So I think that that's where we're going to stand right now.
Dr. Ricardo, we've heard a lot about long COVID or extended COVID-19 symptoms. What do we know about this?
But yes, and sorry, I'm going to use the same question to keep on insisting on people getting their vaccine, because everyone now has at least an acquaintance, if not someone in their family, who has been infected with COVID-19. Fortunately, most of the people that we know that were infected with COVID-19 had mild cases, and some of us may start to think that COVID isn't that bad and say, well, maybe I will take my chances. But there's something that is coming out and that we're starting to notice that is known as post-acute sequela of COVID-19. And we're starting to see people who had symptoms and people who did not have symptoms who are developing long symptoms that will last more than 6 months, and different set of organs, respiratory symptoms, muscle aches, headaches, loss of sense. Indeed, 70% of people who had severe COVID are having some kind of neurological symptoms, including depression, suicide, ideation, or even seizures. And we have gastrointestinal symptoms and also menstrual symptoms in some females. So what I'm trying to say with this is that we don't want to get COVID, and the idea is to try to be prepared to be vaccinated, so we don't get the COVID or the long COVID.
Absolutely, Dr. Ricardo. And finally, I know we're doing this especially on a Tuesday because there is a vaccine clinic that is available tonight and also over the next little while. Would you mind giving us that information, please?
Thank you. Yes, every Tuesday we have a after-hours vaccine. We call it an evening clinic in which people can just walk in here at Servicios de la Raza. We're open. You don't need an appointment. It's very easy. Just come in, walk in, and you can get your vaccine. We have Pfizer and Moderna vaccines, so people just walk in and they get their vaccine as they come in.